Hi, I'm Dan Ashley, the evening news anchor for ABC 7 News in San Francisco, and I hope you and your loved ones are staying safe, healthy, and comfortable during these very challenging times. I am also a proud board member of the Commonwealth Club, one of our most important Bay Area institutions. The club has been hosting wonderful events with exciting speakers and topics in the Bay Area for over a century. In times of crisis, good information and strong connections in our community are especially important. And during the current COVID-19 crisis, the club has really stepped up. Since March 6th, the club has brought you over 100 live-streamed events with speakers and panelists, including past governors, secretaries of state, and many, many more. Every program includes a live chat, so you and viewers all over the Bay Area and beyond have been able to ask these experts the questions that are on your minds. Every program has been neutral and unbiased in true Commonwealth Club style to get to the bottom of the issues that are so drastically affecting our lives. The club has done all this public service despite being profoundly affected by the crisis. The inability to hold events for the past 2 months has forced the club to cut its budget and staffing by 50%. The remaining staff are working from home to bring the community these valuable and informative live-streamed programs. The club needs your support to continue its shelter-at-home programming. Please make a tax-deductible donation to the club now by texting the word DONATE to 329-4231. That is, donate to 329-4231, or visit the Commonwealth Club website, commonwealthclub.org. We need the club to be here in the months and years ahead to help inform and educate as we figure out how to get our society and our economy safely moving again. Consider changes to the way we live and work as a result of this crisis, and take steps to prevent a future pandemic. Once again, please support the Commonwealth Club now by texting the word DONATE to 329-4231. That is, donate to 329-4231, or visit the website commonwealthclub.org. I want to personally thank you for supporting one of our community's truly great organizations. I'll see you on ABC 7 News and at the Commonwealth Club. Stay safe.
Good morning and welcome to today's Commonwealth Club Forum, an agenda for elder justice. I'm Gloria Duffy, President and CEO of the club. In the COVID era, the club is presenting about a dozen live stream programs every week on a wide range of public issues to help keep our society connected and help us continue to work together to improve our society. We thank our members, our generous sponsors and donors, and you, our audience, for your support and participation during this time. You can find everything you need to know about the club and its programs at commonwealthclub.org. Today's program is presented by Grown Ups, one of the club's 15 member-led forums, each one of them on a topic they explore and educate about all through the year. Grown Ups is a name that was intentionally chosen years ago by this forum's founders. And at the end of today's program, you'll meet Grown Up Forum co-chair Denise Michaud. Very appropriately, we are talking a lot about social justice today for many groups in our society. But what is the largest and fastest growing group in American society? It's our senior population. Elders have been seriously impacted by coronavirus, both by virtue of their medical vulnerability and because the way some seniors live today in group facilities has put them at risk. To put it bluntly, our senior population is dying in large numbers from coronavirus. But seniors faced challenges well before coronavirus, from discrimination, elder abuse, and the need for greater respect for their wisdom and the contributions they make in a fast-paced world that often focuses on the young and the new. What is justice for elders? This provocative question will be addressed today by a terrific expert and leader, Lisa Narenberg. Lisa is the executive director of the California Elder Justice Coalition, a group of advocates that protects the rights, independence, and safety of older people. She is on the faculty at San Francisco City College, where she teaches gerontology, health and aging, elder abuse, and ageism. She's the author of 2 books, Elder Abuse Prevention, Emerging Trends and Promising Strategies, and a new book, Elder Justice, Ageism, and Elder Abuse. She's also advised the You Get Clark Foundation, dedicated to preventing elder exploitation, whose president Ian Clark Devine spoke with us just recently at the club. Ms. Narenberg is a graduate of the University of Minnesota with master's degrees in both social work and public health. In conversation with Ms. Narenberg will be Bill Benson. He's a longtime thought leader and driving force on health and aging. He's served in a number of positions, including as Deputy Assistant Secretary for Aging at the Administration on Aging at the U.S. Department of Health and Human Services, and as staff director of both the Subcommittee on Aging of the Senate Labor and Human Resources Committee and the staff director of the Subcommittee on Housing and Consumer Interests of the House Select Committee on Aging. Now, please send your questions for Ms. Narenberg via chat. They'll go to Bill Benson, who will pose them to her. And now please join me in a warm Commonwealth Club welcome to Lisa Narenberg and Bill Benson.
Well, thanks, Gloria. And thanks for all the work that you've been doing in elder financial abuse and for bringing the issue to the Commonwealth Club. It's really an honor to be here today. And thank you, Denise and the Grown Ups Forum, for inviting me. It's a pleasure to be here with the grown-ups. So when I was writing the book, I couldn't have imagined that we'd be at this inflection point at this point, where it seems like just about everybody is talking about justice. But I feel really fortunate that it happened that way, because I think older people really have an enormous amount to contribute to that dialogue, and I hope that they will. Can I have my first slide? Actually, my next slide. So I wrote the book because I've been working in the field of elder abuse prevention for over 35 years. And during that time, abuse has been called a medical syndrome. It's been called the flip side of child abuse. It's been called a caregiving issue, domestic violence, a public health problem. But then in the early 2000s, it was reframed again as a matter of justice. The Elder Justice Act of 2010, which was part of the Affordable Care Act, was our first federal legislation on elder abuse. And it says explicitly that older people have the right to live free from abuse, neglect, and exploitation. So this reframing of abuse, or freedom from it as a right, I thought really resonated. In elder abuse prevention, we confront a whole range of threats to justice that go beyond elder abuse. And one of our main challenges, I think, it goes back to our origins. Back in the early 1980s, when states started developing their elder abuse prevention systems, they designed their responses after systems that had been developed a couple of decades earlier for child abuse. And the assumption was that older people, like children, weren't going to be able to come forward or weren't going to be willing to come forward and ask for help themselves. And so we mandated third parties people that were likely to suspect abuse or to witness abuse to report to public agencies that would then go out and do investigations. So with kids, it's pediatricians and teachers and daycare workers. And with adults, it's virtually anyone that works with older people. And that list keeps getting longer. Here in California, just as of this month, we've added of investment advisors and brokers to the list of mandated reporters. And while that system has really clearly helped a lot of people, it's also led to accusations of ageism and paternalism. And so it seemed like it would be a good time for us to reevaluate what we've been doing. So can I have my next slide? For those of us who grew up in this country, we take it for granted that we know what justice means. We pledge allegiance to a flag that stands for liberty and justice for all. We memorize in school some of the lines from the Declaration of Independence. And of course, there's Superman's oath to truth, justice, and the American way. But today, people are questioning those values and what our founders meant by values like that and how they apply today. And so, what I was interested in is how they apply specifically to older people. So, I started with the basics: the right to life, liberty, and the pursuit of happiness. Can I have my next slide? So, the right to life never actually made it into the Constitution or into any law, but it's been appropriated, and I think rather brilliantly, to refer to the rights of the unborn. It was a lot harder to find a definition of the right to life after birth, but I found this one that I think is really a great starting point for elder justice. It comes from a philosopher, Martha Nussbaum, who defined the right to life this way: it's being able to live a life of normal length, not dying prematurely, or before one's life is so reduced as to not be worth living. And she goes on to say that in free societies, people have to be adequately nourished, sheltered, and protected from assault to function. Next slide. I think her definition is particularly poignant if you consider that in this country, the richest men live on average 15 years longer than the poorest. And for women, that difference is 10 years. Nearly 50% of low-income adults have disabilities compared to just under 11% for adults overall. And African Americans are twice as likely to develop dementias, and for Hispanics, it's 1.5 times as likely. So I think that Nussbaum's way of talking about the right to life really forces us to ask why it is that the right to life is so much farther out of reach for some groups than it is for others. Next slide. Happiness, or the right to pursue it, also never made it into law, at least in this country. To see what that would look like, you'd have to go to Bhutan, where happiness isn't just a national goal, they have a measure of gross national happiness. So on the lower left, you can see what they call the 4 pillars of happiness. It's equitable socioeconomic development, good governance, and the preservation of culture and the environment. And I think these measures don't just contribute to the quality of life, they're also prerequisites to justice. You can't really have justice if you don't have good governance or social development. Next slide. To understand what the founders meant by liberty, you really need to remember the context. As you know, they were coming out of a monarchy, and they were really deeply afraid of slipping back into one. So what they were really worried about was government overreach. So Jefferson described liberty as what the people are entitled to against every government on earth and what no government should refuse. So essentially, the founders were defending people's rights to be left alone. And they made it very clear that when the government restricts freedom, it has to be for compelling reasons and that there has to be due process. Of course, at that time, those rights only applied to very few people, and we've been fighting ever since then to make them apply to everybody. But I think this way of defining liberty is especially important for older people because of the tendency we have to want to limit people's freedom as they get older. And it's often well-intended. Mom or dad are starting to have trouble at home, and the kids think that maybe they'd be better off in a nursing home. And in elder abuse, we're always weighing safety versus freedom, trying to figure out when, as a nation, we have a responsibility to protect people while also protecting their freedom. There are a lot of different ways to think about justice. There's our justice system, which was designed to protect us from the government and from each other. And today we're certainly questioning how well a job it's doing in protecting people's rights. If you haven't read Gloria's terrific column in the spring issue of Insight, I'd really encourage you to do it, because in it she describes some of the barriers that elders face in seeking justice in the civil justice system. And a lot of other people, including Bill, who you'll be meeting later, are asking about how defunding the police or re-imaging law enforcement in this country, what that's going to mean for elders and elder abuse. Next slide. Justice is also about fairness and equity. And a lot of what we call aging policy in this country was created to achieve what's called distributive justice, which is fairness in how societies distribute resources and opportunities, and also intergenerational justice, which is equity between the young and the old. So, for example, Social Security was created during the Depression when people of all ages, and a lot of people of all ages, were facing poverty, but the poverty rates for older people was especially high. And so Social Security really tried to level the playing field a little bit between the young and the old and the rich and the poor. Medicare also advanced distributive justice, and it also was in the interest of racial justice because hospitals couldn't be eligible for Medicare funding if they discriminated against Black doctors or patients. Next. So another major milestone in elder justice was the Supreme Court's Olmstead decision, which didn't even actually involve older people. The Americans with Disabilities Act of 1990 established that people with disabilities had a right to reasonable accommodation in the community. And that really referred to in the workplace and in public settings. But then in the late 1990s, attorneys representing two women with mental disabilities who lived in a state-run institution made the case that their clients were actually capable of living in the community if they had reasonable accommodation, and that failing to provide them with reasonable accommodation deprived them of their rights under the Americans with Disabilities Act. And courts later ruled that Olmstead also applied to nursing homes and even people that were living in the community that were at risk of being institutionalized. So Olmstead has really had an enormous impact. Before that time, people had been arguing that people should be able to get their care in the home. And it was usually because that's where most people want to get their care, or they made the argument that it was less expensive. But as a result of Olmstead, that reasonable accommodation in the community is a right. Next slide. So individual rights are also addressed in international law. And after World War II, world leaders came together to try to ensure that the abuses that the world had just seen would never occur again. And so they created the United Nations, and they also created the Universal Declaration of Human Rights. Now, clearly, universal applies to everybody, but it wasn't long before individual groups started coming forward and asking for special protections. Next slide. And that led to human rights conventions, which are agreements between countries. It's really a kind of a treaty. It's not like the events, the way we think of conventions today. There are actually 7 conventions for human rights, and they're listed here. So some of them actually have special protections for older people. For example, the Convention for the Rights of Women addresses discrimination against older women. That usually applies to things like inheritance laws. And the Convention on Torture and Cruel Treatment mentions restraints in nursing homes and withholding pain medication from people. There's an active movement on now that's to create a convention for the rights of older people. And it's really interesting. There's a rich body of research and writing that's coming out of that initiative. And I'd really encourage people to take a look at that if you're interested. I think it really enriches our way of thinking about justice in this country. Next slide. Another way of looking at elder justice is through the lens of ageism. I used to teach a class, as Gloria mentioned, in ageism. And every semester I would start out by asking the class what the students thought ageism was. And without fail, somebody always brought up the Golden Girls. And we end up getting into these discussions about whether the girls portrayed older women in a positive light or a negative light. Were they good for the cause or bad? And I think it's true, how we portray older people in the media does affect how we think about aging and how we think about our own aging. And so it certainly is important. But Robert Butler the geriatrician who coined the term ageism in the late 60s, was really interested in institutional ageism, or how ageism is baked into our systems. He founded the International Longevity Center, which produced a report card on ageism that looked at these 7 different metrics. So they include things like elder abuse, poor care in nursing homes, and the fact that older people fare so poorly during disasters. He also talked about discrimination in healthcare and business and the media. And Butler and his colleagues really believed that it was ageism that accounts for our failure as a country to devote the resources that we need to prevent elder abuse, and our failure to enforce regulations in nursing homes, and our inattention to people in disasters. And we're certainly seeing the results of that today. Next slide. Maggie Kuhn, who founded the Grey Panthers, picked up the anti-ageism banner, and she and her followers really saw themselves as part of the broader social justice movement of the 1970s. So in addition to calling out ageism, they also aligned themselves with advocates for racial justice, for women's rights, for gay and lesbian rights. They also marched against the war in Vietnam. I was really disappointed to learn that just a few years ago, the National Grey Panthers organization had disbanded, just when I think we need them the most, but there are local chapters and state chapters that are still going strong. I think another development that really laid the groundwork for elder justice was the infusion of public health into aging and elder abuse. Can I have my next slide? And today the public, I think, is really getting a crash course in public health. But I worry that it may be kind of a distorted view of what public health is. Public health isn't just about lockdowns and quarantines, masks, and ventilators. It's true that public health has always been concerned with disease epidemics. And in fact, it was started during a cholera epidemic in the 1850s in London. But over the years, it's really evolved over time to address a much broader range of threats to the public health, ranging from everything from gun control to domestic violence to climate change. And epidemiology, which we're hearing so much about today, is the research method that's used in public health. So epidemiologists look for risk factors that predict who's going to experience health problems or diseases. So risk factors, which are also called predictors, include things like individual behaviors, smoking and leading sedentary lifestyles. And it can also be things like gender and age, personal characteristics, or even where people live and where they work. And so the goal is to identify risk factors and reduce the ones that we're able to in order to protect whole communities from health problems. So in recent years, epidemiologists have found that some of the strongest risk factors for things like early death and disease and disability, and even elder abuse, aren't individual characteristics or traits or behaviors, but in fact are social factors, factors like racism and trauma and social exclusion, illiteracy, living in unsafe and underserved communities. And these are called social determinants of health. And so in the last 2 decades, a primary goal of public health has been promoting health justice. Next slide. So public health offers a lot of really great tools for addressing threats to the public's health. That includes the ecological model, which isn't exclusive to public health, but it's used a lot, which looks at health threats from 4 different angles, from the individual, interpersonal, community, and societal. And it offers interventions at all 4 of the levels. And public health also offers a continuum of prevention for preventing problems. So primary prevention is considered the gold standard. It's preventing problems from occurring in the first place through things like reducing risk factors. Secondary prevention is catching problems early on when they're easier to reverse, and that can involve things like screening and checkups. And tertiary comes in after the fact, after problems have already occurred. And there the focus is on reducing the harm. So as you can see from the arrows, public health isn't impartial. Primary prevention, as I said, is really the gold standard in prevention. And so are interventions at those bottom levels, at the community and societal levels, because those are the ones that really affect the most people. And it occurred to me when I was working on the book that these frameworks might actually be a good way to think about elder justice and combating ageism in society. So if I could have the next slide. So this is how I think of it. At the individual level, elder justice is about protecting and defending individual rights. At the interpersonal level, it's about preventing abuses of power between people. At the community level, it's making communities more inclusive and accessible and safer for everybody. And at the systems level, it's institutionalizing elder justice in our law and also in public attitudes and opinions. Next slide. So individual rights clearly begins with civil rights and threats that we face to those rights. We know that things like racism, sexism, and the many other forms of injustice not only continue into old age, but they intersect and they have a cumulative impact that I think accounts for some of those glaring disparities that we see in life expectancy and health and wealth and security. But older people face some additional threats to their rights, and a major one is clearly cognitive impairment. We know that as we get older, we're much more likely to experience cognitive decline, and that risk of cognitive decline increases as we get older, and it sometimes reaches the point where we're not able to exercise or defend our rights. So one way of, just an example of a way to guard against that is through things like advanced directives, things like powers of attorneys and trusts that are used to make people's wishes known in advance. But actually, very few people have advanced directives. And like all safeguards, when it's used incorrectly, for example, when advanced directives are placed in the hands of the wrong people or for the wrong reasons, they can actually become licenses to steal. When people with impairments who don't have directives and they don't have families to act for them, and they're in imminent danger, courts may be asked to step in and appoint guardians, or what we call conservatorships in California. But guardianship also can be abused, and I'm sure a lot of you have heard some of the media accounts of egregious abuse by conservators. And guardianship is also a restrictive intervention. And so we have to be careful that we don't overuse it and that we have good alternatives. There are a few programs like daily money management and supported decision making that can help some people make decisions without actually taking control away from them. But those are actually there aren't nearly enough of them as we need. There's also a lot of talk today about limited guardianships that are tailored to meet specific needs. And at CEJC, we've been working with Congressman Ted Lieu of Los Angeles to request federal funding that would help states look at their guardianship laws and try to improve on them and look for alternatives to guardianship. So older people have other rights that are often disregarded. They include their rights as consumers. Consumers of long-term services and supports have rights. That includes things like protections against dangerous services and products, which requires government regulation, and that we enforce those government regulations. And so when nursing homes pressure people into signing unfair binding arbitration agreements, or when safety regulations aren't enforced, it may be violating residents' rights as consumers. In elder abuse, we also talk a lot about victims' rights. I think most Americans know their rights if they're arrested, even those of us who haven't been involved directly with the criminal justice system, but we watch television dramas. We probably know you have the right to an attorney. If you can't afford one, one will be provided for you. But fewer people know their rights if they're victims of crime. And that includes the right to things like restitution from perpetrators, compensation for crime-related expenses. It's also the right to tell courts how they've been affected by crimes, and that usually happens during sentences or parole proceedings. Next slide. A lot of older people are denied those rights as victims. There's also been a lot, I think, next slide. At the interpersonal level, elder justice, excuse me, I guess you're going back one slide. I missed that. At the interpersonal level, elder justice is clearly about elder abuse, and that includes elder abuse in its various forms: physical abuse, financial abuse, neglect, and withholding care. It's also domestic violence, which often continues into old age, and that's really about using power and privilege to control intimate partners. Undue influence is when people who are more powerful use that power unfairly to manipulate or exploit people who are less powerful. I think when we talk about interventions in abuses of power, our response has been kind of uneven. We have a lot of screening tools to look for abuse and to look for undue influence, but there's been less attention to prevention. I think we also need to pay more attention to reducing harm once abuse occurs. So I think, for one thing, popular culture would have us believe that the only thing that victims want is to see their perpetrators prosecuted to the full extent of the law and to serve the harshest sentences possible. But those of us that work with older victims, we know that there are a lot of other things that victims want. They often want to get back what they've lost and make sure that they're not going to lose more. And often in abuse, we see abuse by family members. And when abuse is by family members, victims oftentimes don't want to see their children go to prison. In fact, they want to see their children get help. And so that may be things like substance abuse counseling or treatment for mental illnesses. I'd also like to see a lot more attention on restorative justice, which focuses on restoring and rebuilding relationships and the damage that's been caused by crimes. So sometimes that may involve bringing whole families together or trusted members of the community. A few communities in California had elder courts, which gives judges a lot more flexibility in how they handle cases, and often involved really enforcing restitution and bringing in other people that were involved in crimes. Unfortunately, some of the elder courts that we had have actually disbanded, which I think is really regrettable. Next slide. At the community level, elder justice is about making our communities more accessible and safer and reducing isolation. I think a great example is age-friendly communities. And that's an approach that comes from the World Health Organization, where communities bring together leaders and they talk about everything from transportation to housing to crime prevention. And some people have even said that in a truly age-friendly community, we wouldn't have elder abuse. I have a little bit of trouble getting my mind around that one, but when you look at what epidemiologists are telling us, that social isolation is really one of the strongest risk factors, I think there's an awful lot that we can do to make our community safer for everybody. At the community level, we're also talking about fairness. And we're seeing a lot of injustice and discrepancies within communities and between communities in terms of access to services. I've been a big proponent of community health workers. We had a terrific program, a community health worker program at City College where I used to work. And community health workers, or CHWs, are members of underserved communities who help build trust between the community and the formal healthcare system. I think they're trained in things like health education, health literacy, motivational interviewing, community organizing, and how to advocate for both individuals and for whole communities. They're also trained to help people manage chronic conditions, things like diabetes and hypertension, those things that we see have played such a large role in increasing vulnerability to COVID. Community health workers, for some reason, have just not really caught on in the field of aging, which I think is unfortunate. I think we're seeing today what happens when people don't trust the information they're getting or the people that they're getting the information from. And so I think it would really behoove us to look more into community health interventions, and community health clinics is another way of improving access to underserved communities. Next slide. At the systems level, elder justice requires that public policies are constitutional and that they don't restrict people's rights unnecessarily. Nina Cohn is a constitutional scholar that I interviewed for the book, and she's done some really fascinating work looking at whether things like our reporting laws and our guardianship laws meet those standards that the Constitution set. And spoiler alert, she concludes that some state laws are better than others. I really would recommend that you look at some of her work. It's really fascinating. Mainstreaming is the idea that is making sure that older people's interests are reflected in virtually all of our public policies and programs. And I've talked to some advocates who go to forums on everything from women's rights to immigration to crime prevention, and they're always jumping up and asking, what about older people? It's really hard to imagine that just about any public policy that's being discussed today doesn't affect older people, whether it's immigration or climate change or criminal, all of the items that we're hearing so much about today. But affecting systemic change isn't just about policy. I think it's also about changing the public's attitudes about old people and ageism. So a number of communities have launched anti-ageism campaigns, which I think is really great as long as we don't fall into the trap of identity politics that divides people rather than unites them. And in particular, I think we need to reject the generations at war narrative. Next slide. I think part of the problem is that programs like Social Security and Medicare are seen as aging programs that only affect older people. And when I was teaching, I used to try to get students to realize what an enormous stake they had in making sure that these programs were there for them. But it also has to work both ways. Older people have a tremendous stake in the success of younger people, and in particular, younger immigrants who provide enormous amounts of care to older people and really contribute to our communities and our economy. Unfortunately, because of the way that a lot of our programs are funded, the young and the old are often pitted against each other. So I think we really need to reject divisive tactics like that and allocate resources based on demographics and needs and not on politics. You know, studies have shown, there have been some recent studies that have shown that the public actually responds really well to the language of elder justice. But I think we need to go beyond branding and messaging to give substance to that rhetoric. It's not just enough to reject ageism and elder abuse. I think we need a positive message that's anchored in those fundamental values that some of us were raised with and reimagined to meet the challenges that we face today. And so I believe that we need to make elder justice about Nussbaum's right to life for everybody, Bhutan's pillars of happiness. I think it's striking the right balance between freedom and safety and ensuring that when we do restrict rights, it's done as surgically as possible with due process. It's also about prioritizing interventions that do the greatest good for the greatest number of people and striking the balance between prevention and remediation. I think it's about fairness within communities and between communities. It's reasonable accommodation under the Americans with Disabilities Act and Olmstead. It's devoting the resources that we need to problems like elder abuse. It's consumer rights and victims' rights and the rights of prison inmates and those who are returning to their communities under compassionate release programs. It's also about mainstreaming to make sure that the interests of older people are always recognized in all our policies. And I think it's also following in the footsteps of Maggie Kuhn to align with social justice advocates of all ages. So the elder justice agenda isn't done. It's really just a starting point, and hopefully it provides some new ways of thinking about elder justice and possibly suggesting ways that people can get involved. I think now more than ever, it's really critical that all of us bring our passion and our expertise, whether that comes from professional training or life experience, to the table, and that we promote those values that we were raised with, that so many before us have fought for, and that it's now up to us to preserve. And so, if I can have my next slide, I'll end by making a plug and inviting people, if you are interested in joining the dialogue, to think about joining us at the California Elder Justice Coalition or supporting our work. You'll find us at elderjusticecal.org, or you can follow us on Twitter at elderjusticecal. And now it's my great pleasure to introduce my friend and colleague, Bill Benson, who's no stranger to those of you who work in the field of elder abuse or aging. He's been a thought leader for many, many years, as Gloria said, and he's currently the policy director at the National Adult Protective Services Association and has a list of credentials that would use up the rest of the time that we have today. But I do want to mention one. For the last 20 years or so, Bill has hosted the first person series at the Holocaust Museum in Washington, D.C. It's really an amazing program. I've had the chance to sit in on some of his interviews, and at the ones that I attended, at least, there were a lot of young people in the audience, and I can't think of a better way to teach young people about human rights than through that program. So are you with us, Bill?
I am. I seem to not be able to get the video started. There we go. All right. Lisa, that was outstanding. Terrific, terrific presentation. You covered an incredible amount of the waterfront in a very short period of time. Yes, thanks for bringing up my work with the First Person program at the Holocaust Museum. It's probably one of the most profound work experiences that I have ever had the pleasure, if I can use that word, of being associated with, mostly because I've had the opportunity to get to know intimately a large number of Holocaust survivors and work with them, an extraordinary group of people. I think from a social justice standpoint, when one thinks about the Holocaust or any genocide, you have to really step back and think about the horrors of the state. When the state itself decides that it's going to trample on justice, it's pretty tough to overcome that. And that might resonate with folks thinking about some recent developments, even in our own country. But when the state steps in and says, we are basically going to deprive people of their rights, we're going to deprive them of due process, we're going to deprive them of liberty, we're going to deprive them of life, and we're going to do it unmercilessly, it's very hard to resist that. And I think the second takeaway for me from this is the extraordinary level of complicity by ordinary citizens, and if not complicit, just the silence from so many, much of it driven by fear. But as the saying goes, silence is complicity, and from there it all unrolls. We could spend a very long time talking about that. But I'd like to turn to you, Lisa, with a couple of questions. And I'd like to, you've taken on such big themes in your book: elder justice, ageism, elder abuse, all within the context of social justice. I'd like to start, however, with ageism. That's, to me, that's an incredibly important topic because I think it undergirds so many of the issues that give rise to wanting to create or improve rights for older people. It's partly in response to ageist policies, ageist behavior, ageist attitudes. Nursing homes have been referred to over and over again as the epicenter of the coronavirus pandemic in the United States, as older persons have suffered more deaths than any other cohort, and so many of those deaths have been in nursing homes. We've even heard high-ranking officials, elected officials, suggesting that older people should essentially be sacrificed to save the economy. So my question for you, Lisa, is what do you think the impact might be of this pandemic on ageism, which I think you and I would agree is deeply ingrained in our society?
Yeah, absolutely. Yeah, those comments. I think a lot of people have really been shocked and outraged by comments like that. I think people that never really thought about ageism are now thinking about it in ways that they haven't in the past. And, I really want to applaud the media. I think the media has done a terrific job during the explaining to the public not just about what's happening in nursing homes today, but also talking about the situation that led up to what we're seeing today. And so I think we really need to try to build on that attention that we've gotten through this pandemic and build on it and to look at some of the other items that the International Longevity Center listed on their report card. I think it's kind of depressing to think about, to consider that we're talking about some of those failures that they were talking about decades ago, things like the inattention to nursing home regulations and the inattention to people during natural disasters. So long ago, we were alerted to them, and we're seeing today that we haven't done a great job.
In 1987, I was deeply involved in helping to craft the most sweeping nursing home reform legislation we've ever had, known by the silly name OBRA 87, but that's what it was called. And in 1987, when we passed that legislation and it was signed into law, we truly believed it would reform nursing homes. All these years later, I'm not the least bit surprised that the epidemic had its most visible face and impact in nursing homes. It reflects, in my judgment, just absolutely ingrained ageism that's reflected in things you've talked about: the failure to regulate laws and regulations, the failure to hire enough inspectors to go out to facilities, the failure to really care about the rights of those individuals, and then be stunned that we end up with this situation in which we've been basically indifferent to as a society, quite frankly, for a long time. But I'm going to shift a little bit. Lisa, as you know, I've worked with CDC in the public health sector for the last several decades. I came to public health fairly late. And I, like you, see public health, elder abuse being framed as a public health issue, because I think it truly is that. And I'm intrigued by your use, as you went through, of the ecological model of elder justice. How do you see this ecological model of elder justice as it relates to the COVID-19 crisis?
I think COVID is a terrific, if you can say that, a case study in elder justice. And, I could go through those 4 levels of intervention and comment on how each of them really has been tested through the COVID epidemic. And, just one example in the area of individual rights. I know the situation now has gotten a lot of people thinking about advanced directives. I've heard people say, I'm going to go out and look at my advanced directive. Sometimes we think of only in terms of advanced directives for finances, but I think the epidemic has really forced us to think about how we want to be treated if we ever are in a situation where we can't make decisions for ourselves about our own care. And something that's really been striking to me through the pandemic is that over my career, I've been involved in a number of medical ethics groups where we've spent a lot of time talking about weighing the benefits and the risks of different treatments, and how people's personal preferences and their attitudes really need to be reflected in those choices. And you see today how so many choices are being made, or so many decisions about people's medical care is being made on the fly by emergency responders. And you hear them talking, and I think it really is taking a toll on them. It's really difficult for them to be in a position, on top of all the other things that they're dealing with, to have to make these decisions that are really very value laden, without having information about the people that they're making decisions about. But going through those layers, looking at the interpersonal level, clearly we know that we see more cases of domestic violence and scams during this time. And I know in the work that you're doing with Adult Protective Services, it's really raised challenges of how you protect people during emergencies. But I think probably the most glaring instances of justice that have kind of come to light through the pandemic has to do with communities and the disparities that we see between communities, not just in terms of PPEs and access to health services, but also in those pre-existing conditions, the fact that we have these disparities in people's vulnerability that goes back many, many years.
I'm going to shift gears a little bit now on our questions, Lisa. You're fairly critical, if not quite critical, of mandatory reporting, and that's mandatory reporting of incidents of abuse, neglect, or exploitation. As you mentioned, we've got mandatory reporting laws in a lot of states. You write about that in your book. I was involved in writing California's first mandatory reporting law. I later regretted that to a large extent, to be truthful, but there it is. So do you think that with respect to public policy that we've gone down the wrong path in creating and then expanding mandatory reporting laws?
Well, I have been critical, and I don't think that we can say that we've taken the wrong path. But I think what we can say is that we don't know. As you know, it was the federal government that really raised this issue into the public consciousness. But then the federal government really left it up to states to develop their own response systems. And as I mentioned earlier, all of them kind of adopted the same model. There's only one state, New York, that doesn't have mandatory reporting. So we don't really know what another system would look like. From my experiences with New York, I think they've done a great job there. And I'm curious, I don't know, maybe you do, whether or not there have been evaluations that have looked at the impact of a mandatory system compared to a non-mandatory system. That's actually one of the reasons that I've been interested in looking at elder abuse and elder justice in other countries, because there are other countries that have looked at our mandatory reporting laws and have chosen to take a different route. And I think it's important, though, that we look at work like Nina Cohn's and look at specific laws within states. One of the things I think one of the problems with mandatory reporting is that we tend to kind of let other entities in the aging network off the hook. We tell people if they just report to Adult Protective Services, we'll take care of it. I think that really gives the wrong idea that we need to be, as a community of service providers and as a broader community, as a broader public, we need to be thinking about what we could be doing to make older people safer in their communities.
To my knowledge, there's been very little, if any, evaluation of states' mandatory reporting laws. My major concern with mandatory reporting laws is that they get passed with, considerable fanfare very often. Policymakers, legislators like to say, we're responding to the elder abuse crisis. We're requiring doctors and social workers and bankers and fiduciaries and the public to report when they suspect a case of abuse or neglect or exploitation. My guess is that by and large, since we have no data, that it's the law is honored in the breach. We have no idea if people actually report, because we know that there's very little assessment of people not reporting, and certainly no penalties accrue, even if the state requires a penalty for failure to report. I would be willing to bet that virtually no penalties anywhere in America have been provided for failure to report, but I'm guessing failure to report is widespread. I think it's to a large extent, it's a hollow victory in many respects, not entirely. I know we're getting tight on our time. You and I have worked in this field for a very long time. I won't say how long, but a long time. Lots of decades, as a matter of fact. We know that today, and some of it's driven just sheerly by demographics and an aging society, but the numbers of older people who are abused are simply staggering. Some data suggests 1 out of 10 older people have been abused. And we don't have enough research on that, but we've got some pretty good beginning ideas about that. We know that that the number of elder abuse reports exceed the combined total of child abuse reports and domestic violence reports in this country. And the reports seem to be growing in numbers, particularly with respect to financial exploitation. If you were issuing a report card on what has been accomplished with respect to elder abuse, what would you grade and what would those grades be?
Well, I don't think I can come up with a with a letter grade, even though I've been a teacher for a long time. I've gotten out of that.
I had that in mind.
Right. I think where our greatest success is really that, we've laid down some markers. We've said that society doesn't tolerate taking advantage of old people. And, we've also developed myriad interventions to prevent abuse. And there's been an enormous amount of innovation and creativity that's helped countless peoples. And I think we really have to applaud our field and each other for being able to accomplish that. I think, though, that where we have fallen short is that as a field we've been marginalized or siloed. I think we're just coming to terms, for example, with the fact that justice in old age requires that we address injustices earlier in life. That many of the problems that we see in old age result from people's experiences earlier in life, and so I think we really need to be working more closely with our colleagues and fellow advocates and activists in the broader human rights movement. I think going back, though, to reporting, one of the pitfalls of the reporting system is that it creates this expectation that when you make a report, things are going to be handled. And again,
Right.
I said this before, that I think we need to make sure that people everywhere are thinking about how they can reduce risks for older people and prevent abuse. So I think we still have a lot of work to be done.
I would agree with that, but I like your sense of what we have accomplished, which is very nice. I think we're getting close to the end of our time. And so I think we probably need to turn it over to Denise in just a moment. But Lisa, before I do that, can you tell our viewers how they can get in touch with you?
The best way is through CEJC, the California Elder Justice Coalition. We're online at elderjusticecal.org, and you can also follow us on Twitter. That's the best way to reach me.
Okay, that's good. Thank you, Lisa, and thank you for just giving us a window, really, a brief window into all that you've had to say in your book. It's a marvelous piece of work. You deserve a great deal of recognition for that, and I'm glad the Commonwealth Club is doing that by virtue of this program. So I'm going to turn it now over to Denise Michaud, who is the head of the Adult Forum, and for her to say a few final words. Thank you,
If I can
Denise.
just butt in before you do, I just want to say what a pleasure it is to be working with you, Bill, and you've been so instrumental in this field. I really appreciate it, and I could continue talking to you for hours and hours. So thanks.
Well, we will. And I misspoke. Denise is the chair of the Grown Ups Forum, which is a so much better title than the Adults Forum. Take it away, Denise.
Thank you, Bill and Lisa. Our thanks to both of you, Lisa Nierenberg and Bill Benson, for joining us today. And thank you so much for sharing your important work. I want to thank also our viewing audience for tuning in. And don't forget to visit commonwealthclub.org to see all of our upcoming programs. So again, I'm Denise Michaud, Chair of the Grown Ups Forum, and this concludes our virtual program at the Commonwealth Club. Everyone have a wonderful day. Thank you again.
Bye-bye.